first conference session for this year's ICTEL Expo, it's on driving healthcare efficiency through emerging technologies. And this session is powered by Vodacom Business Nigeria. We know the importance of health in our lives. Like they say, health is wealth. And you can also leverage on technology and ICTEL and technology to enhance healthcare delivery in Nigeria. I'd like to invite to the stage the main speaker for this session. His name is Mr. Lanre Kolade. He's the MD and CEO of Vodacom Business Nigeria, who are the main sponsors of this session. Can we have a round of applause for him, please? You can do better. Can we have a round of applause for him, please? Mr. Lanre Kolade. Nice to have you. Please permit me to invite to the stage the moderator for this session. He's the chairman of Audio-Visual Unit of E-Learning, College of Medicine, University of Lagos, Professor of Pediatric, Professor Abiola Oduwole. Can we have a round of applause for him, please? For her, please. Thank you very much. Remember, there will be Q&A sessions after each, after all the panelists have spoken, so you'll have the opportunity to ask the speakers your questions. I'd like to move on to introduce the panelists for this session. I would like to call on the Honorable Commissioner of Health, Lagos State, Dr. Jide Idris. Representative of the Honorable Commissioner for Health, Lagos State, Dr. Jide Idris. The next panelist on the list is the MD and CEO, Avon Healthcare Limited, Barrister Mrs. Simbo Bello Okiri. Can we have a round of applause for her, please? Yes. Our next panelist is the founder and CEO of Flying Doctors Nigeria. Ladies and gentlemen, can we put our hands together for Dr. Ola Orekunrin? Dr. Ola Orekunrin. And the final member of the panel for this session is the Group Head Commercial and Strategy, Mikio Healthcare Limited, Dr. Kunle Megbu Wawon. Can we have a round of applause for him, please? Dr. Kunle Megbu Wawon. Yes. So we have the moderator, the main speaker, and all the panelists seated. Happy deliberations. I would like to invite the main speaker to give his opening remarks. MDCO Vodacom Business Nigeria Limited, Mr. Lanre Kolade. Let's have a round of applause for him, please.
Good afternoon, distinguished ladies and gentlemen. Thank you once again for coming here to this wonderful event. On behalf of Vodacom Business Nigeria, I want to give you a bit synopsis, or should I say, a kind of prick your minds to see what we see as the transformation in healthcare. What I'm going to talk about today will be one that is not going to be too technical, neither is it going to be all over the place. I'm going to try as much as possible to just figure out and show you what we feel Internet of Things will do and how it will affect healthcare. One thing that is very sure and that's very obvious is that healthcare delivery in any part of the world right now is a big challenge because resources are scarce, the population in the world is increasing, and the ability to deliver healthcare at the cheapest possible cost needs to be innovative. So there is a huge strain on the current infrastructures that we have, and with that, we believe technology will be able to transform this and do it a bit better. So in Vodacom, Vodacom is part of the Vodafone family, and we pride ourselves as one of the leaders in innovation when it comes to Internet of Things and how to change the way these things affect our lives. So part of what I'm going to do today is show you some statistics that I hope will not scare you off, but at least at the same time set the scope of what I'm going to talk about so you understand the nature of the problem that we have and how far we need to go. The Nigerian Population Commission, as the statistics that are out, says we have about 30 million Nigerians within the ages of the newborn and 4-year-olds. And the statistics is actually very, very scary, where you have about 10% of that starts actually not going to make it to their 5th birthday. So that's a very glaring problem that we have. So practically 3 million kids will not make it to their 3rd birthday. Also, it's also a big issue. I don't think my slide is working well. Oops. UNICEF also said something very scary, that more than 2,000 kids and about 145 women of childbearing age actually die practically every day. It's an alarming stat. So the issue is, it's actually very, very disturbing to know that if we actually had very essential interventions for this number of people, they will not actually die. So what can we do differently, like I said, what we have right now to try and change these dynamics? So the entire ecosystem itself is being in trouble. So we have mounting concerns currently on it. So the question is, what can we do and how can we leverage on what we currently know and what we can do differently to change the dynamics? When I started earlier, I was talking about resources. We all know every time government talks, government will say there's no budget, there's no money. So overall, the earlier speakers were talking about around 80 million Nigerians. The figure on that slide is very, very scary. 8,688 naira per person. I'm sure some of some brands of anesthetic lately it would be very expensive for that amount of money. But that is what is in our current appropriation budget for all of us as Nigerians to get into healthcare. So you can see that it is not possible to use what we currently have to get there. So digital care is not only healthy for a country like Nigeria, but it will also improve quality and efficiency by bringing information together. So the more we know about ourselves, the more information that we have about people, the more we can actually use the current budget that we have to address the issues better. So what IoT will do invariably is gather information. When Dr. Aladekomo was talking earlier, Sir Aladekomo, when he was talking earlier, he was talking about big data, artificial intelligence. If you can get enough data about how many people in Nigeria practically has a particular kind of illness, you can actually target the scarce resources that we have to that particular area. So that's what we believe that IoT will kind of do, and will give you a better way of looking at the resources. So also, Part of the problem that we have are the healthcare workers themselves. We have a problem in Nigeria right now, in a lot of African countries, where we have brain drain and the rest. There are 2 healthcare workers to 10,000 people. So you can see how that is very difficult. What we are advocating in Vodacom and in a lot of the telecoms companies is that you can actually use a lot of these new innovation technologies. Instead of actually going to the hospital, okay, you can actually have unified communications where you can do a bit of crowdsourcing of doctors. And if you are in that pool, you can get access to your own intervention. Dr. Oladikon was talking earlier about WebMD. You can, we are not advocating that you do a lot of self-medication, but at the same time, if you don't need to go to the hospital, the question is you don't have to go there. Because if you have to spend 1,688 naira on you alone, we would rather want to spend that thing on somebody that actually needs it and have very chronic ailments. So in more developed societies where the internet penetration is higher, broadband penetration is higher, people get to see the doctors and use Skype to actually see a doctor. And you have a doctor session. The most important thing is that you get the professional advice and you get it done appropriately. So part of the issue is with Internet of Things and with technology, you can actually train more people. So you can move these dynamics of 2 to 10,000 to a more higher number, and you can get better penetration of people and distribution of drugs and other services. So I have laid the foundation of what I want to talk about and what we see the problem is. So the question is, how does IoT and how will IoT help alleviate and solve some of these issues? IoT itself is actually connected medical services. Imagine, for example, we have vaccination coolers, and which I am not a doctor, but I'm told that these vaccines must be stored at a particular temperature, and they must be secured and all that. So imagine if in those containers or in those coolers, you get to have sensors that actually transmit real-time data of the status of the vaccines. So before the vaccines actually get to where they're going to go to, you actually know the efficacy of those vaccines so that we don't waste any dollars' time. You get to track the vaccines. If they say they are taking 10 containers to a particular area, you know that it's going to get there and that it's fixed. So you can actually calculate the spend that you're doing and get to know exactly what to do. So how is IoT going to change this? We believe honestly that it will improve the economic outcomes for health. And how will this happen? IoT in itself, like I said, it's the connected healthcare revolution. And governments have a problem. And the bulk of that problem is policy making. If we know that, okay, for example, we know the issues that we have as the black race with sickle cell. But it's also possible that there are a particular area within Nigeria where people are more prone to a particular kind of disease in a way, maybe because of what they eat or the way the area is and all that. If statistics can be gathered by government and they know that in a particular place they have an epidemic of a particular sort, maybe because of the drugs that are being used in that area, and they know that the stockpiles of that drug is actually going down, government can actually address that and deal with that as the needs be. So IoT will help government in a way to actually gather the amount of data and address a particular epidemic in the right amount of way, so that they don't just send resources in a way where it is not efficient. So government in itself will be able to have an increased access to healthcare, okay, because the scope will be enhanced. If I have an healthcare worker that goes to a remote village and all he has is a tablet or a very handheld device, and can take biodata of everybody in that village, and that biodata can actually go to maybe a central database and capture the details of everybody. If by the time you know the demographics of everybody in a particular entity, you know exactly what kind of resources you can actually apply to that entity. So they can capture very real-time data, and they can get to very hard rate just with a simple tablet device. So instead of actually getting a doctor to go there specifically, you actually have the biodata of everybody. You know, okay, there are 10 pregnant women in this locality. There are 10 children, you know. So you have that, and then you know exactly what kind of doctor, what kind of resources to apply to them. You can also make these things a bit cheaper because if you know and you have that resources, like I was saying earlier, you don't send your entire task force or the medical task force to that location. You only set targeted requirements, and then you're able to address the issues as need be. So we can also improve the primary health care that is needed, because prevention, we all say, is better than cure. So if you know what you're addressing, you will be more able to actually sort the issues out. So when you tend to do preventative instead of actually curative, it helps in reducing the cost of healthcare. And that's one of the things that we believe that IoT will also do. So it will expand the preventative care that we currently have. In a lot of developing countries, what they've realized is that they have an aging population. Now, that population itself are very knowledgeable themselves. So they don't necessarily, like I said earlier, have to go to the hospital. So you can actually prevent a lot of these things and educate them more on some of the ailments that they have, and get to get these things done more appropriately. I think there's something wrong again with the slides. Okay. My sincere apologies. So, if we can decentralize healthcare, if we can make seeing the doctor a bit less, in quotes, important, and you can actually get people to do these things themselves, they can be faster. If we can get to have, one of the biggest challenges we have in Nigeria right now is statistics itself. We don't even know how many of us are in Nigeria. So the question is, how can we know how many kids under 5, okay, are actually there per se? How many of them actually need a particular kind of vaccine? We know all the issues that we have in the north and with polio and the rest. Statistics is very important. So what IoT does is it gathers these statistics and it allows you to be able to do a lot of things, and you can prevent a lot of these things from happening. So I spoke earlier about containers that have sensors that can monitor the temperature of this of the vaccines, and thereby increasing the efficacies of them. If we can do that simple thing, okay, it will mean that if government, for example, spends $1 million on vaccines, that $1 million will actually be used and not be wasted. So IoT will drop and reduce wastage. So what it will do invariably is increase the coverage of the immunization programs that we have them right now. I spoke earlier about record keeping and at the healthcare facility, because the more information that you have, the better you can actually deal with people. We are currently doing a project right now with the Kaduna State government, where all the primary healthcare centers actually have a centralized data recording system. So what happens is when the government buys these drugs in bulk, say for example, they buy a malaria drugs, and they keep them in these healthcare centers, they get to take an inventory of that entire stock. So every time they get to use them, that record gets updated. So the Commissioner for Health in Kaduna will actually sit down and know exactly what is happening in Kafanchan. Okay? So that way he has a dashboard in front of him where he can see exactly what is happening in each of the local governments and maybe the villages even, depending on how they separate the primary healthcare centers. So what this does is, if for any reason there is a particular epidemic in a particular place, they can actually pinpoint it by actually just reading data and not just even waiting for a report. Because by the time they realize that a particular kind of drug is getting dispensed more in a particular area, then they will know that there's a problem. Okay? And instead of buying new stock, they can actually move stock from a particular area to address that other one. So this big data actually gives you that information and the ability to do that. And like I said, we're actually implementing one right now for the Ghana government. So I also spoke earlier about improving remote monitoring, and the example that I gave was actually that of capturing data with a simple tablet and an app. Somebody gets to go into a remote village, gets to capture the temperature, okay, the biodata of the people, the basic bios, like the medical people will call them, of that person, and sends that to a central database. So when any kind of intervention is going, they get to do that intervention very, very simple. So remote monitoring in the rural areas is very, very transformative. And it is very, very important because you get to, like I said, have information and data to intervene without actually getting to do the big time hospital visits that are very, very costly and inefficient. Because then you get to deal with the issue as you see them and sort them out in real time. So there is a lot of money being spent in hospital visits. The stats that we had said about $26.4 million dollars is actually being spent only for remote monitoring. Okay, which means that you have actually saved yourself a lot of money because doctors have time are very precious. So if you can actually get to do all this, you get to save much more for the doctors. So IoT will make this happen and will make it even more cheaper. So IoT in healthcare is already being used in the United Kingdom and a lot of other developed countries. So we just have to get our ass together and do more of this in Nigeria. So the healthcare market itself for IoT is also, like I said, improving already and is already high. Thank you. So it's not something that is new. It's just for us in this part of the world, we are lagging behind and we should do things a bit faster. The funny thing about it is it's actually more important for us because we lack the resources. So to be able to leapfrog some of these things, we need to borrow some of these technologies and do them a bit faster. So when we talk about IoT, we're talking about connected devices. When we talk about connecting devices, imagine you having your pacemakers embedded in you and sending the data of your heartbeat directly to your doctor. Imagine you having a device inside of you that checks your insulin levels and actually tells you exactly when to take your drugs and all that. So these are the kind of things that we're talking about. So something within your system talking to your phone, sending an SMS to you and saying, look, you just missed your drug now and you should take it now and all that. So if you can do these things faster, we believe that a lot of things will happen. The last time I was talking to somebody about this, the guy actually asked me, you're talking about all this IoT and all that. Where is the power that we use to power the equipment to get it to work? And what I just say is, we've had that conversation before about Nigeria and power. All of us have a mobile phone. One way or the other, we found it to work. We actually have like over 100 million phones in Nigeria right now, and they're working. So we, as Nigerians, can always find a way to make sure these things happen. So we believe that with IoT implementation in Nigeria, government will have more resources to deal with. They will have targeted resource allocations. They will be able to get the right statistics of the right illnesses that we have in Nigeria, which ones are preventative, which ones are chronic. They will be able to address what they need to address in terms of service delivery to all of us. And when they allocate budgets to us, they will be able to use it better. So the question that I ask everybody every time is, are we actually ready for IoT and to get our healthcare better in Nigeria? Thank you very much.
Thank you so much, Mr. Kolade. You've really hit the nail on the head concerning medicine. We really want to improve ourselves and make it faster, our patients to spend less time, and move on and hit the nail on the head. To further expound on what we've just heard, I would like to ask Dr. Molayo, the representative from Lagos State, in what way, knowing that Lagos State, we have both land and water, how do you hope to use this digitalizing device, if it ever comes into place, to help you in policy making, in patients using the NHIS, stock out? Could you just tell us how the government is doing now, what they're doing to make this possible?
Thank you very much. Good afternoon, all. Thank you very much for the beautiful presentation. I'll start off by saying currently in Lagos State, we have a platform which was implemented by the Lagos State Ministry of Health in collaboration with Ministry of Science and Technology, which is called the eHealth, which was the pilot phase started in on the 5th of January 2009, which was piloted in Lagos University Teaching Hospital and also Lagos General Hospital Lagos and General Hospital Isolo. The second phase is just being carried out now in another 10 general hospitals, Ekpe, Badagry, General Hospital Shomolu, General Hospital Ibejuleki, and so on, which is it's a way of reaching out to patients, having the information, the data on healthcare system, and it's easy, efficient in attending to patients, which is very fast. So right now, Lagos State has a platform which is eHealth, which is currently in progress and is still ongoing. Thank you very much.
That's good news too. I mean, for all of us to know that we are actually digitalizing and we're moving forward. Now we're coming to the NHIS. There's so much talk about NHIS, HMO in the recent times. And I know that for the NHIS and the providers, the problem is actually sometimes how to get your bills across to the NHIS and how to be attended to with immediate effect, so that that gap that we are seeing now is filled. So in what way is the NHIS, what are you doing as a group? Yes, as a group, what are you doing to digitalize and make things move faster?
Thank you very much, Lady Moderator. I'm the MDC of Avon HMO, and we are an operator that is regulated by NHIS at the moment. You've kind of hit the nail on the head with that question, because the cry and the yearning of our hearts as operators within that system is to have the entire industry move into the 21st century. You know, it's amazing that there is no IT infrastructure within which the movement of money can be made transparent to our regulator at the NHIS. I mean, if you look at the key players within this sector, you have the HMOs, you have the hospitals and other healthcare facilities, and then you have the regulator. But you also have the people who are paying the HMOs, and this might be, you know, federal ministries or statals or companies or even individuals and families paying for themselves. The first bit of the puzzle is that how do you even ensure that the regulator has an overview of everything that is going on within the sector? And there's a huge gap there now because it's a black hole. The regulator can't see anything. We need to do something about that. We need to put something in place.
So you really do need this digitalization?
Oh, we really do need it in order to achieve great efficiencies in our sector. In addition to that as well, HMOs are individually, I know our company has individually invested in the IT infrastructure that is necessary to help hospitals submit their claims to us electronically so that these claims can also be paid. But, you know, we're still paying through us at various banks. It's possible to actually have a switch.
Okay.
You know, it's possible to have a switch where, you know, the information as well as the payment that happen between hospitals and HMOs can be automated. Okay. In addition to that, you know, there's also electronic medical records, which I believe all hospitals should move towards. That will make that interconnectedness really, really happen along the entire value chain. Because part of that health ecosystem is also the pharmaceuticals who produce these drugs. You know, someone talked earlier on about stockouts and things like that happening. So the opportunities and the ways in which technology can enhance delivery of healthcare to the Nigerian population is immense. Access is also a thing. You know, we are, you know, the only HMO right now where you can, through your mobile phone, subscribe to a health insurance plan. That's giving access to Nigerians no matter where they live. So there is a lot of opportunity for technology to help enhance healthcare delivery.
Okay, I'll move us into the 21st century.
Yes.
Thank you. I've always liked to meet you because I've heard so much about you, and I know you're doing wonderful work. And I know many times we have patients, we have to move, and we have to get in touch with you. Sometimes the phone is not working, or the service is down or something. So how do you do it?
Absolutely. I think technology itself gives us a really unique opportunity in healthcare, not just to do more with less, but actually to do better with less. And at the Flying Doctors Nigeria, which is West Africa's first air ambulance company, that's what we've always aimed to do, to be able to do better with less. So we actually started with a solely private jet structure where we're moving people with private planes across the country, out of the country, even into the country from other West African countries for treatment. And we eventually have had a look at the model again and realized that affordability was an issue. So we started speaking to the commercial airlines, and within a year, we had built a completely unique insert that could be fit into an intensive care unit that could actually fit into the back of a commercial plane, taking up just 6 seats. And we had reduced the price of a trip from Port Harcourt to Lagos from about $20,000 with a private jet to under $2,000 with our new system. So that's what technology and innovation can do in healthcare.
Thank you so much. From Mikil, you know the lab is our backbone. We need all the help from you. And many times you are waiting for the electrolytes to come in, or if you're dealing with a diabetic, you're waiting for the urine results to come in and to make decisions. So how do you want to use this digitalizing feature to help us, we doctors, to help our patients?
Thank you so much. I think at Mikio Healthcare, we have moved beyond asking that question to actually using digital technology. There's a product we launched recently in which you can actually do comprehensive healthcare with as little as 15,000 naira. Formerly, it used to cost about 180,000 naira. What did we do? We provided an app where once we take a little sample of blood from you, you get your result on the app, and you can download it, send it to your doctor anywhere. So real time, your sample is taken, and then we get it done. So in terms of the digital space, we've been investing so much in researching. We've been investing so much in getting to know more and doing more about it. And to Nigerians, one of the things we are looking at is in terms of cost. Our population is large, but many cannot afford the cost of healthcare. So we must bring down the cost. So there are machines these days that can do over 2,000 samples at a go. So the more samples I can run, the less the cost of it. So we do a lot of cost-benefit analysis, and we try to say, okay, if we get the reagent at very reduced cost, we can actually bring down the price, and we can do more for Nigerians. So with as little as 15,000, which almost everybody can afford, you can do a comprehensive healthcare. And right now, we are not talking more about curative. We are looking more at preventive. How do we prevent? There's something called the iceberg phenomenon, where the iceberg underneath it is a huge rock, but above is one tiny rock. Our body is most times like that. Electrolyte derangement, we don't even know there's an electrolyte derangement. And there's a tumor going on somewhere, there's a cancer going on somewhere, we don't even know. But with that comprehensive health check, you have access. So the patient is educated, the doctor is also educated, the doctor has more information, he has more results with which to work with. So we are moving on in digital space.
Okay, thank you. That's very good news because I know that information is very important in making diagnosis in medicine. And a lot of times your patients resist you because of lack of information. So I'm very sure if Vodacom can develop a way whereby all this the right information, because the problem we have is there are information on the net, but most of it are not right. So we want a way that our patients will be able to, not only that, I know that also in medicine, even for teaching our students now, we're now thinking about how do we digitalize teaching, because we're having more students and it's not easy. So there are a lot of things that are going on, and we hope Vodacom will not just think of that, you make it a global thing and think about how to help teaching, training, and everything. I would like to thank all the panelists. You've been wonderful. And I think the audience have been able to get a lot of information concerning digitalization and medicine and the growth in Nigeria. Thank you. Okay. I've told I still have time to ask questions from the audience. I think because I don't have much time, we'll just take 3 questions. The first one is from...
Okay.
Thank you. Mine is just a comment of appreciation to Vodacom. I'm a CSR advocate, and I've followed Vodacom for quite some time. I want to appreciate all that you're doing. And because if you are into health, I know you are into several other areas. I just want to say well done.
Please introduce yourself and the person you're directing your question to.
Thank you very much. I'm Sunday Afangimo, a self-employed radio site technician. My question goes to the boss, the Vodacom boss. He mentioned a few things about the Internet of Things, which I'm quite pleased with, and I think I got interested in the part where he said it's going to enhance medical care. And I was going to ask a question, but Oga made a reference to it about an app that enhances medical diagnostics. However, how is the Lagos State government, in conjunction with the Ministry of Health, ensuring a proper implementation of Internet of Things in its system to enhance medical care? Thank you very much.
Okay.
Good afternoon. My name is Bosunsho Larry. I'm a dry cleaner and I'm a member of the chambers. I would love to get some more clarifications from the scientist, from the lab man. Where are those things? Where and where can we get what you have talked about? Thank you.
One more question. And
Good afternoon. My name is Sholan Elakunle. My question is, can we shed some more light on the e-health scheme?
thank you.
Good afternoon, thank you. My name is Adetola Salah and I run an NGO for education. My question is directed towards Dr. Ola. Thank you so much for coming. I met you in April and I'm very happy that you came back to honor us with your presence here. You mentioned, or it was mentioned earlier that you had talked about integrating something like WebMD here. I would love to hear you elaborate a little more about that. I know you don't have that much time. Thank you.
Thank you.
We now take answers to the questions.
Thank you very much for the questions. Concerning your question on shedding more light on e-health, like I said earlier on, e-health is an interactive hospital information system software. It's being implemented by the Ministry of Health in collaboration with Ministry of Science and Tech. And The pilot phase commenced fully on the 5th of January 2009 in the Lagos State University Teaching Hospital, LASUS, and also in General Hospital Isolo and General Hospital Lagos. And currently, we're in the second phase of the e-health, which is being piloted in General Hospital Ekpe, General Hospital Ikorodu, Shomolu, Badagry, Surulere, Lagos Island, Island Maternity, and General Hospital Bagada and Orile Agege. Presently, the e-health is about having access to patients, easy and fast, and making it easy for the patient for a real-time information. And also the question that he was asked about the internet, we're in collaboration with the Ministry of Science and Tech. So presently now, there are so many, like he said initially from the man that represented the Honorable Commissioner for Science and Tech, that presently they're doing a lot of internet facilities in so many parks, and just the same way in most general hospitals where you can actually have access to information and data on patients. Thank you very much.
The question I got was about e-health. And it's so interesting, such an interesting question, because our whole conversation has actually revolved around this topic of access to healthcare, and how easy it is to access healthcare. And the reason why I started an air ambulance service is because I realized that a lot of people that get sick die not necessarily because the help they need isn't available anywhere, but they're simply at the wrong place at the wrong time. So our CSR program, I'm from Ekiti State, and our CSR program focuses on helping women from Ekiti. And a few years ago, we had a program focusing on contraception, providing contraception for rural women. So we had a partner in Ado that was in charge of distribution. And the program failed because, according to my own conclusions, Ekiti women did not want to access contraception. So we put it in one place, Ado, and we expected people to be coming from Ikere and Ado and Ilawe and all the other, despite the topography, to access it there. And the program completely failed. But obviously, I blamed the women. I didn't see the fault in the system. In November, I got married and I started looking to access contraception with all the money in Lagos State. And to be honest, I just couldn't find anywhere to get it. So I traveled to London last week. I went on Google. It took me 5 seconds to find a website where there was an online doctor. I saw the doctor. Within 3 minutes, he had done a questionnaire with me. I spoke to him about what I wanted. He said, okay, this option can give you 3 years of family planning. I said, I don't want that. So don't let my in-laws send me to MFM. I just want something that is temporary and will work. And he said, okay. Within 2 minutes, he had dispatched it at my local pharmacy. I had paid my money. And within 7 minutes, I could walk down to the pharmacy and access healthcare. And that is the beauty of these solutions.
The question I got is, where and when can you get this app and access to this comprehensive health screening? We are everywhere. If you go to our site, www.micure.com, you'll be able to reach us, give us a call. We will dispatch our lab scientists. They will come at the convenience of your home, take your blood and urine. That's all you need. And with that, you can have up to 90 investigations done, and you get the results on your phone. You get your phone number as your username and a password which is unique to you. And with that, you have your test done. A lot of people have done it. We took an example doing it for the chambers, and a lot of them got to know their health status.
Thank you. I hope we're all thinking about ethics in everything we're doing, and we're making sure we're getting consent from going home. Because we also have to also include that in everything that we do. Thank you. I don't think we have more time for questions, but it has been an interesting afternoon, and I'm sure a lot of us have gained quite something on digitalization in medicine. E-medicine is the way to go at the moment. Thank you.
Thank you very much. Let's have a round of applause for the 1 second, sir. I would like to take group pictures. That concludes this session. Let's have a round of applause for the moderator, the main speaker, and all the panelists. I'm sure you learned quite a lot from that insightful and informative session. I think you can move closer. Can we have an electronic smile? Thank you very much. Let's give them a round of applause, please, for that wonderful session.